Hello, my dear friends. This is Dr. Charles from PHI Preventive Health Institute, where we share practical lessons drawn from real cases we see every day. Behind every symptom is a real story, and today's topic highlights a common misunderstanding. We are talking about anemia and iron treatment. This is a topic many struggle with because low iron is not always corrected simply by taking blood tonic. Treatment only works properly when the body can absorb, tolerate, and consistently use the medication. That's why our team breaks these topics down from four perspectives. It takes a village. What the doctor evaluates, what the nurse manages, what the pharmacist safeguards, and how the dietitian supports recovery. This is the pharmacist perspective. Let's look at how this begins in real life. In real life, anemia rarely begins dramatically. It usually starts quietly. Fatigue, low energy, dizziness. It can be very subtle at first. Shortness of breath during normal activity, difficulty concentrating on tasks. At first, many people explain it away. Maybe I'm stressed. I just need a break. Maybe I'm not sleeping enough. Maybe I'm just overworking and need more rest. Then, iron treatment is started. An improvement is expected immediately by the patient. But when recovery feels slow, another pattern often begins to emerge. Doses are skipped, tablets are taken irregularly. This is where the problem starts. Iron is mixed with the wrong foods or drinks. Side effects appear and cause worry. And gradually, the treatment system breaks down. We must prevent this because iron treatment is not simply about swallowing a tablet every day. It is about absorption, consistency, and rebuilding healthy blood over time. So the pattern becomes start iron, stomach discomfort develops, doses become inconsistent. The iron stores remain low and fatigue continues for the patient, not because the medicine failed, but because the process was interrupted midway. Now look at what is commonly misunderstood in this medical process. Iron supplements are not instant energy boosters. They take time to work. The body needs time to produce healthy red blood cells again in the marrow, and that recovery may take weeks, sometimes months of dedicated treatment, which means occasional treatment does not work well. Consistency matters more than anything. Then comes another layer side effects. Iron may cause constipation and nausea, stomach discomfort, dark stools, especially during the early stages of treatment. So, what often happens? The medication is reduced without any professional guidance. The tablets are stopped completely, or doses are taken only when feeling weak. And while symptoms temporarily fluctuate, the deficiency quietly continues underneath. The deficiency quietly continues underneath the surface. Then comes interactions. Iron does not absorb properly with everything. Tea can reduce absorption significantly. Coffee can reduce absorption. Milk and calcium rich products can interfere as well. So even when someone says, I'm taking my iron, the body may not be receiving the full benefit. Now, the system shifts. Poor absorption leads to slower recovery and persistent fatigue. This shift leads to frustration with the treatment and the process as a whole. What is iron supposed to do? Iron helps the body rebuild healthy blood cells, and it improves oxygen delivery throughout the body for better health. But to do that effectively, it must be taken correctly and consistently by the patient, not casually, not occasionally, and not alongside habits that reduce absorption. Then comes structure. Take iron exactly as prescribed by your doctor. Allow time for recovery. Avoid taking it with tea, coffee, or milk products. Report severe side effects early instead of abandoning your treatment plan. Review other medications and supplements for any possible interactions. Because inconsistency slows recovery quietly without you noticing it. The body is trying to rebuild blood supply. Iron is supporting red blood cell production. Oxygen delivery is trying to improve. Energy depends on that slow recovery. Everything is connected, and when treatment becomes irregular, the body struggles to recover fully. But when done correctly, the outcome changes, improved energy, and better concentration. You will see healthier blood levels and a safer long term recovery for your body. Final point iron supplements are not simply blood tonics, as some believe. Anemia treatment is not about taking tablets, only when symptoms become severe. It is a structured recovery process. Patience and consistency are required by all. So do not stop treatment halfway because recovery feels slow or side effects appear. Understand the process, follow the plan consistently, and review treatment when needed. When to act. If you have persistent fatigue, dizziness, or difficulty tolerating iron, do not ignore it. Speak to your pharmacist or healthcare provider for professional review, or call or WhatsApp PHI at +200 3320872047 for more assistance. And remember to explore the other three perspectives because each one completes the picture.